The recovery is actually pretty easy. You might have some soreness or tenderness at the back of your head, and depending on which technique is used, whether it's the follicular unit extraction technique or whether it's the straight traditional strip surgery, you might have just a mild headache. In the area where the hair is transplanted to, you'll have little short stubbly hairs about beard length. You might develop a slight crust to that area. That area might be a little bit pink, but all of these things are transient. They usually resolve within between 3 and 7 days. The main thing that people notice the most is if they're having transplant to the front of their head, and this would be women as well as men, they might have some swelling right through here. Swelling on your forehead doesn't look that great. It makes you look a little like a Neanderthal or a Klingon for a couple of days. It usually doesn't show up immediately. It shows up about 2 or 3 days after the surgery, and then it takes about 2 or 3 days to go away beyond that. I try and avoid the entire swelling issue by having my patients sleep a little bit upright, like maybe at a 45-degree angle. And that usually helps. With gravity will help to drain the swelling before it even starts. But some patients are simply prone and get some swelling, and so that's what I warn patients about the most, because you can't really hide swelling in your forehead very easily.